Good morning, everyone. I'd like to call the Fiscal Committee to order. Uh, The first item that we have are the minutes from December 2nd. There was a small change that occurred. I believe that was the one. And so I think so. Okay. So could I have a motion to accept the minutes from December 2nd? Yeah, as corrected. Do I have a second? Okay. Senator Gaida and Representative Leishman. All those in favor, please raise your hand. 1, 2, 3, 4, 5, 6, 7. Opposed? Abstain? 2. 2, 7 to 2. 2 abstentions. Okay. All right. The motion passes. The next item are the minutes from December 17th Fiscal Committee meeting. Are there any changes or corrections?
Move to approve.
Okay, Senator Daniels moves to approve. Do I have a second? Thank you, Representative Leishman. All those in favor, please raise your hand. Opposed? Abstentions? The vote is 9 in favor, 1 abstention. Yes. Who else did? Yeah. And then we have our night before Christmas Eve meeting on December 23rd. Are there any changes or corrections? Seeing none, could I have a motion to approve?
Move to approve.
Senator Daniels moves to approve. Senator D'Alessandro seconds. All those in favor, please raise your hand. Opposed? Abstain? 3. So 7 in favor and 3 abstentions. Okay, now turning to the agenda. We have several items that have been taken off the consent calendar. I will go through these now. FS 22007. FIS 22-022. FIS 22-023. FIS 22028. FIS 22030. FIS 22013. FIS 22014, FIS 22015, FIS 22-035, FIS 22036, Three five. There were so many that I couldn't stand it. Okay, and just so that everyone knows, We also have a late item, which is FIS 22043. And of course, we will have to vote on that at the end. So,
Madam Chair,
yes?
my notes indicate on page 422042 off of consent. Is your note different?
No, I did not have that. Did you want it off?
Let's pull it off, and
Okay.
and when we get to it, we could just wrap it up if it didn't need it.
Does the Senate have any additional items that they would like to take off the consent? Yes, Senator Rosenwald?
Thank you, Madam Chair. Just 039 for a quick question.
9.
The carry forward.
No, it's rental assistance.
It's FIS 039, tab 6. Okay. Could I have a motion to approve all of the other items that are on the consent calendar?
So moved.
Thank you, Senator D'Alessandro.
Second.
Second by Representative Edwards. All those in favor? Or do I have to call the roll? No. Okay. All those in favor, please raise your hand. 10-0. Thank you very much. Okay. The first item off the agenda is 22007 from the Department of Military Affairs and Veterans Services. Is there someone here that would? Oh, okay. Thank you. Thank you very much, and welcome to the Fiscal Committee. Oh, you need to, excuse me, you need to push the button on the mic.
Got it.
Okay, thank you.
Thanks, ma'am. For the record, I'm Major General David Michaelitis, the Adjutant General for the New Hampshire National Guard, Department of Military Affairs and Veteran Services. Before you today is a proposal for approximately $290,000 to be obligated or spent for a child care initiative. I provided you a handout which essentially has 3 pieces of information. First piece of information is the mission statement of the Joint Military Task Force, of which I chair one of 8 subcommittees on the Governor's Commission of Alcohol and Other Drugs. Through that initiative, we try to take care of service members, families, and the veteran community. This specific initiative for service members and their families. Second piece of information within that handout is an excerpt from a report from a 2020 analysis of the Army National Guard, the health of the force. And when you look at that analysis on those next 4 pages, you will see that the New Hampshire Army National Guard ranks 45th out of 54 in the country in a bad way for the health of our force. And there are many reasons why. But when you look at it, the 2 primary reasons they called in that report is obviously hearing loss, which is predicated on the fact that as a Army National Guard, we have a lot of what's called field artillery, but more importantly, hazardous alcohol misuse. So when you look at the data, 7.9% of our force has a possibility of hazardous alcohol misuse. This is a pilot program and initiative that we hope will provide or reduce stressors to military families in order to provide child care and drill weekends for our service members. The last piece of information in that handout talks about, I think it was my letter to the Fiscal Committee clarifying some of the reasons why. So the Governor's Commission of Alcohol and Other Drugs voted on this initiative, I think, last March. And like I said, we're one of 8 sub-task force on that commission. Based upon this committee's request, Patrick Tufts, the chair of the Governor's Commission of Alcohol and Other Drugs, is also here. And by the way, there's also ancillary benefits of this initiative. You know, as we look holistically across our force, you know, one of our sort of reasons also is diversity and inclusion. We continue to lose our female servicemen and our female service women based upon the lack of childcare. So for example, at the Peace Air National Guard, our female service women compose 29% of our force when they initially enlist. At the end of a 20-year career, that percentage goes down to 15%. During their process of a 20-year career, our female service women have to make the decision whether they want to continue with their service or whether they want to raise a family. This is a significant issue for us for our retention and our ability to have a diverse and inclusive workforce. Primarily, it's for the stressors associated with family life, whether it's a single family parent, whether it's a dual family parent where both parents serve in the military, or where it's their significant other, their spouse, as a second job. So we require 3/4 of our service members come in for that week and a month because we're a part-time force. This is the reason why. Subject to your questions, that's all I have.
Did you want Mr. Tufts to come and say anything?
Yes, ma'am.
Okay, thank you.
Good morning, committee members. Thank you, General. As stated, my name is Patrick Tufts. I'm the chair of the Governor's Commission on Alcohol and Other Drugs. I just want to add a couple of things to the General's presentation. This particular investment is part of a much broader investment in prevention services, a roughly $4.5 million investment in prevention programs all across the state of New Hampshire that the Governor's Commission has made. As part of its Expanding Our Resources action plan, I've left copies on the table for any of you who haven't seen it. This is the 2001 Governor's Commission Strategic Plan. This particular program is an important part of, again, this broader portfolio of investments for all the reasons that the General just stated. Our service members endure additional stress, endure additional hardships, additional complications in their lives, especially when they're deployed. Child care services and access to good child care services play a critical role in getting our kids off to a good start and reducing the stress on the parents. There were questions about the evidence-based best practices. Again, all the child care programs in the state of New Hampshire do adhere to evidence-based best practices. This is a pilot program, so we can't bring evidence in right now as to what the outcomes of this are. But this particular investment was heavily cooperative with the Prevention Task Force of the Governor's Commission. It was co-developed with the Prevention Task Force, and it really has an emphasis on reducing ACEs, or adverse childhood experiences, and really addressing the social indicators that we have to have in place for healthy kids and healthy families. So while this is a new program to the Guard and a new effort, it really is tightly embedded in our prevention efforts as a state and tightly connected to our strategic plan from the Governor's Commission. So thank you for your time this morning. If you have any particular questions, I'd be happy to answer them.
Are there, Senator D'Alessandro?
Thank you very much, Madam Chair. General, give me an indication of the number of deployments made by the National Guard, let's say over the past 12 months, and how we've dealt with those as they relate to the child care situation and the alcohol problem that seems to emanate from this situation.
Senator, I would say in the last 12 months, we have had probably 300 to 400 soldiers and airmen deployed overseas. Whether it's southwest border, Kosovo, the Middle East, Afghanistan, we're averaging about 300 to 400 soldiers per year and airmen activated.
Further question?
Yes, please follow up.
Thank you, General. I think it's important for all of us to realize that the Guard plays a much more significant role in our military obligations than in the past. and that these deployments sometimes are extended periods of time. It's male and female who gets deployed, so the mother may get deployed, the father may get deployed, and just comment on the alcohol problem, the alcohol situation. I noticed that was mentioned in your narrative.
Yeah, so, thanks, Senator. So again, we believe this is potentially affecting over 200 of our soldiers and airmen. When you look at 7.9% of about 2,800 uniformed service members, this is somewhat significant. I mean, when you see that we're 45th out of 54 in the nation, we stood up a wellness division in our organization using federal resources to bring in a wellness director, a dietitian, a personal trainer, a financial counselor, and we're trying to get after the whole holistic sort of wellness program. This is just a piece of the pie that we're trying to get after the fact that we have an issue, we acknowledge it, and this is where we think we can make a difference.
Thank you, Madam Chair. Thank you, General. I appreciate your service and your commitment. I'm a Manchester Central graduate of the United States Military Academy at West Point, and by the way, a good Greek boy from Manchester.
Okay.
I want to emphasize that.
Yeah, well, we always need a biography
Yeah.
of our people
I'm
testifying.
willing to give that.
Okay, thank you so much. Representative Leachman, you have a question?
Thanks, Madam Chair. Knowing that he's Greek, I guess you have the senator's support. So,
You'll need to move the mic.
just one question, and thanks for taking my question. How many service members do you think would take advantage of this program?
Senator, we're estimating approximately 200 and 250 families would.
Thank you, Madam Chair.
Senator Rosenwald, do you have a question?
I do. Thank you, Madam Chair. Good morning. My question's really for Mr. Tufts. This seems like a creative solution, and I'm wondering if the Governor's Commission has experience from other states of using childcare as a tool to prevent substance use disorders, and more broadly, whether you're looking at that for other populations in New Hampshire.
Some of the best evidence we've seen, Senator, is actually from the business community, who's making heavy investments in childcare to strengthen and reinforce their own workforces. I think this particular program is really cutting edge. I haven't seen it done with other Guard units across the nation, but we're starting to see a increased understanding that childcare is a critical part of keeping not just children on the right track, but also keeping the family healthy. And I think that we can continue to look at, what the business community is doing as a real parallel comparison to what we're trying to do here. But this is a new program, and it's relatively innovative. I think it's something that other states are going to want to copy when they see us put it in place.
Representative Edwards.
Thank you, Madam Chair. So, for the record, I'm a 33-year Army veteran. I've deployed. I appreciate the need for this program. I do have some questions I'd like to just get some clarity. As I understand it, this program is intended to be set up on the weekends. It's not a 7-day program. It's a every weekend program. Is that true?
Yes, Representative. Initially, it's going to be just a week and a month, or maybe 2 weeks during the annual training period. So it's to get after the 70% of our force that are part-time. So 2 weeks annual training, a week and a month.
Thank you. Follow up. Okay, so when I was in the Army, we could violate privacy rights. We would have been able to have sort of a by-name roster of the 7.9% that we think are at risk of alcohol abuse, and then we would be able to set up this program so that we could see exactly who was using it, because we would hope that there's some kind of correlation between those at risk and those using the program. And I'm just curious, since this is meant to be an evidence-based program, the extent to which you guys are mapping the need to the use.
a great question, Representative. Based upon the funding, we have to do a pre and post survey of the soldiers and airmen utilizing this program. So that pre-survey would include, okay, just a questionnaire about, these are the things we're looking after. Like, is there stress in your life? Is this and then post-survey the year later, in the subsequent years later, to like go after the post-survey to look at that data, say, did this make an impact or not? This pilot program.
Go ahead.
Okay, so what I think I heard you say, General, I don't want to misinterpret you. It sounds to me like you're saying you don't have anything like a by name list now of the 7.9% who may be considered abusing alcohol.
That's correct. It's a HIPAA violation. So we don't track. We get the raw data for that 7.9% based upon surveys taken during periodic health assessments as we do our annual medical screening. When those soldiers and service members are then questioned on an annual basis, the issue becomes like suicidal ideations and substance abuse. So that's how we.
Okay.
Okay, one last one. Are you finding in your data that there's a distinction between male and female propensity to abuse alcohol? I'm hearing that there's a great retention opportunity for the female side of the force, and I get that. I think that's great. I'm just curious if we think the female side of the force is much at risk of alcohol abuse as the male side. Do you see any differences?
So the data tends to say that males aged 21 to 25 have a higher propensity for hazardous alcohol misuse. I think it's on one of the pages I handed out. If not, I can get you that information specifically.
Thank you.
Okay, are there any further questions? Oh, I'm sorry, Senator Guida. I knew that.
Thank you, Madam Chair. General, thank you for coming today. Can you provide a metric on like the number of days lost because of alcohol misuse, or perhaps parental, not having a babysitter at home? Obviously, you must have absence data that you're tracking.
Yes, I'll have to get back to you on that. I think we have that data.
Okay, thank you. I appreciate it.
Senator Daniels?
Thank you. Good morning, General. I have one question. If you could give clarification to the initial statement that you said that 7.9% had the possibility of hazardous alcohol use. To me, that's analogous to saying that 20% of the people driving cars have the possibility of having an accident. It really doesn't tell me anything with the word possibility in there. I would say potentially wouldn't 100% have the possibility of hazardous alcohol abuse?
Senator, I would say based upon annual periodic health assessments of which our soldiers fill out a survey for their, like, do you smoke cigarettes? Do you chew tobacco? Do you drink alcohol? On the frequency of alcohol, how often do you drink alcohol per week or per month? Based upon that data, 7.9% of our force has indicated that they have a hazardous alcohol use issue.
Okay, thank you.
Yep.
Are there any further questions?
Move the item.
Okay. Representative Leachman moved item FIS 22007, seconded by Senator Birdsall. Clerk, please call the roll.
Roll call for 007. Representative Edwards.
Yes?
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsall. Senator Guida.
Yes.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
FIS 22007 is approved, 10-0. I really want to thank you for coming in this morning, as well as thanking all of our guard folks for the work that they do, and for serving our country as part-time military people. it's extremely important. So, thank you very much, and have a nice cold day.
Thank you, committee members.
The next item removed is FIS 22-022.
Good morning, Tammy Valancourt, CFO for the Department of Education.
Good morning.
Good morning, Kelly Rambo, Administrator for the Office of Nutrition Service and Program.
Okay, thank you. Representative Edwards, you had some questions on this.
Here he comes.
Here he comes. Representative Edwards, you had some questions on FIS 22-022.
I apologize, I just needed to catch the general in the hall for a second. Can you give me a few minutes to come back to this? Are we able, no?
I will ask a couple of questions while, I'll give him a little time
Thank you.
to get himself together. This is the child nutrition program. And the question I have, is this an extension where everybody gets meals?
Yes, this year, currently, the USDA has a waiver for free meals that is set to expire on June 30th of this year, 2022.
And so these dollars will get us through the 30th of June on the free and on everyone receiving meals?
No.
Oh, okay, that's not a good answer.
When we did an initial assessment, we were using the state New Hampshire First system and looking at the expenses that had been spent to date. When we looked into our food and nutrition system, subsystem, we found that we have not paid out expenses for November and December. So these funds that we are accepting in today will get us through those and into January. We plan to come back again next month because we've done another analysis, and we will be bringing another item before you next month.
So the federal government is paying, that's not the problem.
It is, when we built this budget 2 years ago, we did not anticipate COVID and the changes in the guidance from the federal government. So because they're giving out, we are like doubling our reimbursement requests from the schools.
Okay. So the federal government will continue to support this through the 30th of June. We just need to get our money out to the town, or to the schools.
Yes, we just need to increase our appropriation so we can fund those reimbursement requests.
Okay, thank you. Representative Edwards.
Yes, ma'am. My notes indicate that I'm supposed to motion to accept this money. I don't see any questions. I have questions on the item after this 23.
Okay. Senator Daniels.
Thank you. How do you determine the success? What is the success metric that you're using to determine the success of this program?
So as you can see in the requested action in front of you, that the increase this year in the free meals compared to the years before is highly successful, and that's what we're currently using. The claiming system, each school claims the amount of meals that they have served, and this year, since the meals are free, there is a significant increase, which is why we are requesting more money, additional money.
Follow-up?
Follow-up?
Does anybody track how much of the food is thrown away?
At this time, that is not tracked at the Department of Education.
fine to follow up. And just a couple days ago, I read of some online complaints from parents who posted pictures of the lunches that that particular school was handing out, and the parents saying that wasn't not nearly enough. So this is why I'm asking these questions is, if we're just saying success is based upon the number that we throw out, I'm not sure that that's really the correct metric, because I hear often about how much of the food is thrown away by students, and then this was new to me that that some parents were feeling that their child wasn't getting enough.
So the current USDA regulations have not changed as far as meal standards. Those are still the same that we have been following before. And the claiming process is the schools do not claim meals for which they have not been served to the students. So every meal that has been claimed is a meal that has been given to the students. So, and again, the regulations that the USDA has put out as far as the standards are concerned are the same that they have been before. They're no different than has been in the previous years before COVID.
Okay, and if I may, for clarification, when I talk about food being thrown away, I wasn't talking about the food that wasn't served. I'm talking about food that was served that the kids won't eat, that they throw in the trash barrel.
Yes, thank you. And unfortunately, at this time, the DOE does not collect that data once it goes to the child out in the cafeteria.
Are there any further questions? Senator Gaida?
Thank you, Madam Chair. Can you speak to the numbers of students that are using this program year over year, say from 1920 or 2021 and present, so far in fiscal '22?
So as stated before, due to the fact that the meals are free to all students and not just those students that fill out the free and redo application, there is a significant increase to the meal program. And that is based off of the waiver for this year. So once the waiver expires, we will go back to using the free and reduced applications to use determined eligibility, who would receive a free meal or who wouldn't receive a free meal in that program.
Yes, follow-up?
So there's no financial criteria as far as qualifying for the free and reduced lunch program at this time?
At this time, that is correct. That is a USDA waiver that has been put out for this year. It was in place last year, and it had an extension for this year and expires on the 30th of June.
Are there any further questions? Seeing none, Representative Edwards moves that we approve FIS 22022, seconded by Senator D'Alessandro. Will the clerk call the roll?
022 roll call. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsell. Yes. Senator Gaida.
Yes.
Senator Rosenwald. Yes. Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
Vote is 10-0. This item is approved. Thank you very much, ladies. Appreciate it. Okay, we now turn to FIS 22023, authorization to accept and expend $350,000 in other funds through June 30th. Good morning. It's okay.
Good morning. I'm a little bit of a mess this morning. Patricia Tilley, Director of Public Health.
Okay. Are there any questions? Representative Edwards.
Thank you, Madam Chair, and thank you, Ms. Tilley, for taking my questions. I didn't realize that this program was in public health. Are you sitting in for somebody, or is this your program?
Is this for 30? I was just put up here, so maybe I'm
No,
mistaken.
this is for 23.
Great.
So 23 says it's for the Prescription Drug Affordability Board.
Yep, not me. I told you I was a mess
I am
this morning.
so glad other people make mistakes.
Well, it's just that you spend so much time in that seat that you, that we.
Good morning. Thank you for
Yeah.
clarifying that because I was kind of confused in the back. For the record, my name is Robert Berry. I am the department liaison between the board and the department. I'm happy to take any questions.
Thank you.
Thank you, Madam Chair. And Mr. Berry, thank you for taking my questions. As I'm looking at this, I'm having a really hard time getting a sense that of the extent to which this program is cooked and ready to roll out. I see that it's meant to rely on $350,000 a year of user fees. And if you could walk us through the state of collection around those user fees and at the rate at which you're going to expect to begin expending the money. I'm worried about the cash flow aspect of this program. I'm not seeing any data in here on that.
Certainly. So the board came into being on July 1st of 2020. Since then, we have been working on standing it up. It's an administratively attached board to the department. The primary purposes of receiving the funds is so that the board can hire an executive director to begin really the process of what the board's purpose is. And I'm not extremely well versed in the overall purpose of the board. It's more a question for the board since I'm just the liaison. But the intent is to start receiving the funds so that it can begin the process of hiring an executive director to fully stand up the board as it moves forward and fulfills its purpose.
You have a follow-up?
I do have a follow-up. So if I heard you, you won't be hiring a director until after the user fees have begun being collected, and therefore you do not anticipate a cash flow problem.
No, the board does not anticipate a cash flow problem, or a cash flow problem at this point in time. We believe it should eventually be self-funded, and the big expense is going to be the executive director, at least in the short term. We're in the process of putting forth some legislation that would move the executive director position into an unclassified position, and the search will begin probably sometime in the spring or early summer, is my guess. It's in other boards throughout the United States. This is a fairly new concept. Finding an executive director has proven, quite frankly, fairly difficult. The Maryland board just hired their executive director after 18 months of existence, and that individual was an attorney and a pharmacist, so that's a bit of a unicorn in the world. So yes, to answer your question, though, Representative, we do not believe there will be a cash flow problem.
Okay, follow-up?
Thank you, Madam Chair. I just lost the question, I'm sorry. I think Senator Guida may have a similar question to what I was about to ask.
Okay. Senator Guida, you have a question?
Yes, thank you, Madam Chair. Thank you for your testimony. Could you put in plain language what the function of this board is?
I will try my best. I'm not a member of the board. I'm just a liaison. But the essential function of the board is to provide greater transparency with drug price increases or changes. That's the 40,000-foot view of what the board does. There's a greater in-depth detail, involves data collection, involves developing spending targets and things like that. I'm not overly sure how that works. It's more of a function of the board. But the 40,000-foot view is to provide greater drug price transparency.
Are there any other questions? Oh, okay, thank you.
I had heard that the user fee schedule would need to be approved by GELCAR, and that these fees have not yet been approved. So my question is, what's your jail car plan, and can you navigate that without an executive director in place?
Yes, so the statute 126 BB8 sets a floor for manufacturer fees, which we can begin to start collecting. It's a $500 floor. But beginning Monday, there's a board meeting on Monday, we are soliciting public input on the rules, and we anticipate that they might be in place as early as this summer. So we will certainly include a user fee assessment in that, in the rules for jail car approval.
Yes, Representative Leishman.
Thanks, Madam Chair, and thank you, Mr. Berry, for taking a question or two. So as I read the correspondence from the department on page 3, talk about the assessment that would raise approximately $350,000. Have you, I got the impression you've already started collecting that fee?
We have not started collecting that. That's we were hoping to get an account so we could start collecting it, which is why we're here today. We have not started sending out invoices. Once we have a dedicated account to that, I believe that'll happen soon after. But again, I don't want to speak for the board because I'm not a member of the board, just a liaison. But that's my understanding of the intent.
Further question, Madam Chair?
Please.
So then I look at page 2, and it talks about other fees for other different things, such as pharmacy managers. It looks like that would raise an awful lot more money than the $350,000. Isn't that correct?
Well, right now, we've identified 500 manufacturers that would be subject to the $500 fee. We're still in the process of identifying who else may be subject to the fee, but that's the best estimate at this point in time.
And I guess I have one follow-up, Madam Chair.
You think?
Because of other questions that have previously been raised, I did a deep dive into what this agency is this new board is supposed to do. And one of the things that happened to be missing from the correspondence, and I printed it out, the representative from Auburn touched on this as far as rules. 126-BB:6 rulemaking. And it says the adoption of all fees. Now, the threshold you mentioned, that's the threshold which I assume that would be put forward to jail car as a base limit. But again, the rulemaking, as referenced in your letter, which references :8, says shall be determined by the adoption of rules, which then you refer to, or I referred to the section I just read. So all fees have to go through rules before any fees are adopted. That's how I read the statute. So I'm concerned that we're perhaps moving a little too quickly because the Rules Committee, jail car, has not adopted or approved any fees, I don't believe, for this agency yet. So, Madam Chair, I think this item probably should be tabled until such time those fees are been approved by jail car.
Okay.
Can I respond to that?
Yes, I'll let you.
Well, RSA 126.
Not appropriate.
I apologize, but I think this is important. RSA 126 BB:8 provides statutory authority to assess a minimum fee, which is what this is based on.
Thank you. Okay, I have a motion to table from Representative Leishman.
Second.
Madam Chair, I believe that motion would be out of order since Representative Leishman spoke before making the tabling motion. I think according to rules, it should be made by somebody else.
All right.
I'd be glad to
I
make
have no
that.
problem.
Okay.
I'd be glad to make that motion.
Second.
Heaven forbid I did something wrong. Okay, thank you very much. All right, I have a motion to table from Senator Daniels, second by Senator Gaida. Will the clerk call the roll?
Okay, motion to table. Representative Edwards,
Yes to a motion to table.
clerk votes yes. Representative Erf,
Yes.
Representative Leishman,
Yes.
Senator Daniels,
Yes.
Senator Birdsell, Senator Gaida,
Yes.
Senator Rosenwald,
No.
Senator D'Alessandro. No. Representative Umberger.
Yes.
Madam Chair, the vote is 8-2, table.
The vote is 8-2 to table FIS 22-023. The next item is FIS 22028. Senator, Representative Edwards, I believe you had some questions on this.
I did, yes.
Go ahead. Oh, I'm sorry. We're not, I'm faster than, excuse me. Would you please introduce yourself?
Good morning. My name is Ann Landry, Associate Commissioner for Population Health for the Department of Health and Human Services. Thank you.
I'm Mary Calise, Deputy CFO, DHH.
Thank you, Madam Chair. This question's going to come out of left field a little bit, and I apologize. You two may not be the ones to answer this, but I'm just curious if we are anticipating any use of federal funds in the coming weeks that come into the Fiscal Committee that would address our homeless veteran population. I understand we have about 120 New Hampshire veterans that are considered homeless. Approximately 110 of them or so are in transitional housing and not in permanent housing, and that leaves around 10 that are without any housing resources at all. So I just want to make sure I understand the priorities of DHHS. These things come to us one at a time as they're ready to come to us. So, but I would like to know the bigger picture here. Is homeless veterans, are they a priority? And what are we going to do about it?
Thank you for that question, Representative Edwards. I'm going to invite Associate Commissioner Santinello to come up.
Good morning, I'm Chris Santinello. Right now, we have a number of priorities in the Council on Housing Stability. Much of the dollars to end veterans' homelessness comes through the VA. And so what I can do is I can follow up with Deputy Adjutant General Warren Perry to kind of see where some of that is and get back to you on that. But the department itself does not fund that. It comes through the VA directly or HUD directly to a program in the Nashua area and Easter Seals.
Okay, thank you for that. I understand exactly what you're saying, where you say that most of the money, maybe all of the money, comes through the VA. But I'm asking if all of the money must come through the VA. Do we have discretion in the DHHS to appropriate or request some of this funding to address a problem that's not yet been solved?
So I will, not really. So the federal dollars that come to the department come through the continuum of care, and those dollars have very specific projects, and the only way you can add to those projects and that funding is for an additional project, such as one of the other items on this, the youth demonstration. So that is the only way we can get additional dollars. But I will follow up also with Warren on the numbers, because that was not the numbers that we had for veteran homelessness.
Thank you. I think they're going to be doing a new survey next week or the week after. So
well,
we'll have fresh data.
Yeah, the point in time is later this month. So thank you.
Thank you for that. And if you would, you'll send that to LBA or Janet, one or the other, but the LBA, send it to them. Okay. Are there further questions on the Afghan resettlement? Senator Gaida.
Thank you, Madam President. This may or may not be within your capability to answer, but I have received considerable expressions of concern for the housing of illegals coming into the state. I want to know if you subcontract with housing agencies and NGOs, and if you in any way inquire as to whether or not they are dealing with the alleged illegal population that's being brought into the state.
Thank you for that question, Senator Gaidas. Our state refugee resettlement program works with federal agencies that are contracted by the federal government specifically for refugee resettlement. So our work and knowledge regarding anyone who settles in New Hampshire is strictly with the refugee resettlement program. We don't have actually anything to do with the settlement of immigrants that come here legally or illegally, just strictly the refugees. So our agencies are federally vetted, have been in business. There's 9 national federal agencies that work, and then they have subsets in local districts, and we've been working with ours for over 20 years as a state before the program even came to DHHS. So highly vetted, regulated by the federal government, working simply with the refugees.
You have a follow-up?
Thank you, Madam Chair. Can you state categorically that funds are not being used by the agencies with which you contract to house illegals brought into the state?
To my knowledge, they are not. I mean, I can only speak with the knowledge I have, which is that they're federally regulated to resettle legal refugees who come through the refugee resettlement program.
Thank you.
Are there further questions?
One more.
Representative Edwards.
Okay, this one is for you.
Thank you.
So on page 2, kind of in the middle of the big paragraph, it talks about the goal of achieving rapid self-sufficiency, and then it goes on to read, to that end, Refugee Support Services funding provides job development and placement, employment assessment, orientation to the American workforce, education, training, and referral services, employer supports, and job maintenance, I believe. So I happen to be extremely familiar with the Afghani culture, and I'd like to know if these education programs, these training programs, particularly as it is dealing with employment, if there's an anticipation to segregate the male and female populations until they can get assimilated into American society. Generally, Afghani men, or I don't want to go too far, but I will say that Afghani men tend to have a 18th, 17th century view of women, and training them in the same setting can be extremely problematic and inadequate to bring the Afghani women into our culture rapidly. So would you tell me if there's any anticipation to segregate by gender for these training classes?
Thank you, Representative Edwards. In discussing with our Director of the Refugee Resettlement Program about this question ahead of time, so traditionally they are trained together, males and females in the Refugee Resettlement Program, with the exception of specific programs where there is a mental health, or a cultural issue or cultural historical piece that you just mentioned. So I think with the agencies who are the experts in this, I believe it's at their discretion to determine which training programs for which populations would need to be segregated based on the cultural differences in that society. So there are set ones where the genders are separated, as we would think with physical and mental health and situations like that, and then where there's a cultural difference. So I can't answer your question for sure regarding that specific question with job training with the Afghans, but it is in their purview and their expertise to segregate appropriately when necessary.
Are there any further questions? Yes, Representative Irf.
Thank you, Madam Chair. Thank you for your written responses. They were fantastic. And just to summarize for my own benefit, is it fair to summarize that private agencies have sole discretion in choosing to resettle refugees in New Hampshire, and that consideration need not be given to the costs the resettlement may have on the community?
Thank you, Representative Erb. So I'm not sure it's so black and white in either or. They've been working with these communities for over 20 years in the state of New Hampshire. Mary probably might have a more exact date, but over 20 years, and they do this nationally. So they do work with the communities. There's a Refugee Advisory Council that participates in understanding what the municipalities can handle as far as the cultural competencies within the community, within the school systems, within municipalities, excuse me. So it's not so much that they say no or yes, it's they work together and they partner. And then they provide recommendations for what the state can handle. And our state generally resettles a very, very low number relative to the rest of the country, given that we are a small population, a rural state, small urban areas. So it's very much done in partnership in that way. And the communities where the majority of the refugees resettle participate in this advisory board. And then it's also a conversation with the governor's office as well before those recommendations are made. So it's very much done in partnership. It's not a forceful situation.
Thank you.
Are there any further questions? Seeing none, could I have a motion to approve? Senator D'Alessandro moves to approve, seconded by Senator Rosenwald. Would the clerk please call the roll?
Roll on 028. Representative Edwards.
No.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsall. Senator Gaida.
No.
Senator Rosenwald.
Yes.
Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 8-2.
The vote being 8-2, FIS 22028 is approved. Okay, we now go to FIS 22030. You sure you don't want to talk about refugees as well?
I think the Associate Commissioner handled that well, thank you.
Yes, she did. She did very well. Okay, if you would reintroduce yourself.
Patricia
please.
Tilley, Director of the Division of Public Health Services in the Department of Health and Human Services.
Okay, Representative Erf, you had some questions?
Yes, I just have one confirming question, if you will. Can you confirm that the opioid crisis dashboards are anticipated to be available early February this year?
That is our understanding. We are very close to the end, and we anticipate that they will be ready in February.
Super. And you'll let us know when so we can go look
We
at them?
will.
Thank you.
Senator Rosenwald.
Thank you, Madam Chair. Good morning. On page 2, the narrative in number 4 says enhance the prescription drug monitoring system, but I couldn't see elsewhere in the narrative what those enhancements are. So could you please tell us what's being done to the PDMP?
Sure. Thank you for that question, Senator. So in general, the paragraph that you're referring to in number 4 is the overall work of OD2A, which is the acronym for this particular funding source, Opioid Data to Action. So that's what OD2A stands for. And in general, we provide support to the prescription drug monitoring program for some of their data initiatives to support that. But with these particular funds, there is nothing that we are using in this fund set of this carry forward to do additional work for the prescription drug monitoring program.
Are there any further questions? Senator Gaida?
Thank you, Madam Chair. So safe to say that these funds will in no way increase or decrease the privacy constraints currently on the PDMP program?
That is correct, Senator.
Thank you.
Any further questions? Seeing none, could I have a motion? Thank you, Senator D'Alessandro, seconded by Senator Birdsall. Will the clerk please call the roll?
Roll on 030. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf,
Yes.
Representative Leishman,
Yes.
Senator Daniels,
Yes.
Senator Birdsell, Senator Gaida,
Yes.
Senator Rosenwald, Senator D'Alessandro, Representative Umberger.
Yes.
Madam Chair, the vote is 10 to 0.
The vote of 10 to 0, FIS 2230 is approved. Okay, now we turn to FIS 22-013.
Good morning. For the record, my name is Karen Hebert.
Is your microphone on?
I think it is.
Okay.
It needs to be closer. There we
Thank you.
go. My name is Karen Hebert. I am the Director of the Division of Economic and Housing Stability for the Department of Health and Human Services.
Mary Calise, Deputy CFO.
Thank you. Representative Leishman, I believe you have a question.
Thank you, Madam Chair. Thanks for taking my question. We just spoke about the homeless issue with veterans, and I heard yesterday from a representative in Manchester that it's just getting worse. There's hundreds and hundreds of homeless people. And I noticed, one, of course, this is a very small request, but on page 7, in the middle of the supporting documentation, it talks about the recipient must match all grants and funds, and there's an exemption above, but the box below is checked. So where are the recipients going to get that matching grant money?
The match for that is built into the contract that we now have with Plymouth State University. So the vendor does provide that match.
And just one further question, if I could, Madam Chair.
Yes, please.
Thanks. So I turned back and looked into the dashboard as far as the homelessness issue and the amount of grants. And it's like the third page from the back, and there's a little chart with, I think, the smallest font I've ever seen. But within that, it mentions a number of homeless providers, and it still shows a large amount of money unencumbered. Is that just because of where we are in the year, or are there reasons why that homeless money is being withheld?
So I wouldn't say that it's being withheld, but because of a number of requirements from the Housing and Urban Development Agency, there are several phases to the distribution of funds and having to make frequent amendments to our contracts, which have to be approved, as I'm sure you know, by Governor and Council. So those amendments do take a long time, and often the amendments are needed because we don't have the confirmed award amounts from HUD yet to move forward with them. So there's a little bit of a balance, if you will.
Thank you, and thank you, Madam Chair.
Senator Rosenwald?
Thank you, Madam Chair. Has the department made any changes to shelter rates since the budget was signed in June?
We have not made changes to shelter rates since then, but we are certainly in discussions about that now.
Yes.
So I believe this committee was told that the department would come forward with a plan to do that by last September. Here it is, January. When are we going to see that?
If you would allow me to look into that information and get back to you with an answer, I'd be more than happy to do so. And unless, thank you.
Chris Santinella for the record. There is actually, as you are aware, we can only distribute dollars based on our budget. There is legislation actually, and if you, I cannot remember the actual. 415, that would actually look to add dollars to the department's budget this year directly for shelters.
Yep, Senate Bill 14.
Thank you.
Thank you.
No, that's not the problem. It was the answer that confused me. Senator Gaida.
Thank you, Madam Chair. Does the department have any estimate of the number of homeless youth that we have across the state?
That is one of the reasons why we're moving forward with this demonstration project. We have understand that their youth typically don't want to be found, so it's difficult to count them. The last time we did a point in time count was January of last year, where we were able to identify 46 in the state, and that is pretty much picked from the street. There's other data that the Department of Education has, I understand, which is quite different, but I don't know the criteria or methods of collecting that data.
Thank you.
Yeah, it would probably be a good idea if you talk to DOE, because I know what they do is through the guidance counselors, the principals, and all of those kinds of things. That's how they're obtaining that information. So, and when you mentioned the term 46, I said to Representative Emmerich that I have 46 just in the town of Conway. So, I mean, that number is, you know,
yes.
I wouldn't ever use that number. Okay, that's just my comment. So, somebody had a question? Yes, Representative Edwards.
Thank you, Madam Chair. So I'm just kind of curious about the practical implications of where this program is going to make sure our youth, or I think they say Ute in New Jersey, but that our youths are taken care of. I imagine it's a little bit like chain migration. If you have say a 15-year-old, then it makes sense that the parents, to the extent they're around, would also receive the benefit of a place to stay. And I'm just curious how far that chain migration might go. Would it include grandparents? Would it include aunts and uncles? I mean, once you get one person taken care of, I'm just curious how big a tail, a support tail, we're anticipating.
Thank you very much. So this is really some of the underlying purpose for this particular project, is to really develop that community plan that is subject to HUD's approval. But the idea is to really identify, not just identify the count, the number of youth that are being affected, but what are the circumstances holistically around that. We want the Youth Action Board that is going to be created by the grant to identify that plan moving forward. If HUD approves the plan, then we will be eligible for further federal funding to implement that plan. So there's a lot of this information that has yet to be discovered, but that is the purpose of the project.
Thank you.
Okay. I guess I didn't get a real good answer to Senator Rosenwald's question about when we're going to get some kind of report.
So we can provide you with what we are reimbursing now today to shelters. The department at this point does not have additional funds to pass on to shelters. There was a program through Gopher this past, that ended in December, where shelters could apply for federal dollars through Gopher to cover any uncovered COVID-related costs. There is a Senate bill that would look to add up to $9 million to the department to directly reimburse shelters, but aside from that, we don't have additional dollars in our budget.
Senator Rosenwald?
Thank you. So I think we learned that the cost of a shelter bed was $47
Correct.
a day, and the state is reimbursing $8 a day. There was a plan last year to take it to $20 a day. And it didn't make
pass
it
the
into
budget.
But the department told us they would have come here with a plan in August or September, and it's now January.
But we
so-
don't have, I guess, I believe, if I'm correct, in that we were going to apply for funding through Gopher for that, and instead of money to go directly to shelters, they are using the shelter funds that they did give to shelters, and that was about $3 million. So we're continuing to look at all of the resources, and then one of those resources is that Senate bill.
Could I just quickly follow up?
Yes, you may.
Thank you. So did the department ask Gopher for the amount of money it needed to pay a reasonable reimbursement rate, and Gopher didn't come through after the legislature didn't?
It's
Where
not.
are we?
What we did is we provided Gopher, through the Council on Housing Stability, a number of strategies to assist with ending homelessness and supporting the shelters. One of those was for shelter dollars, and that was what was given with that one-time funding.
Thank you.
Okay. I think that what Senator Rosenwald and the rest of us are looking for is a plan. Even though you don't have the money, okay, that's immaterial. What we're looking for is a plan.
Yep.
Am I correct?
So the
Yeah.
So the Council on Housing Stability, which includes the department, did create a 3-year strategic plan that includes some of this, so I will send that to the full committee.
Okay, as
Thank
long
you. Yep.
as it shows us, today we're paying $8, we're looking to pay 30,
Yep, correct.
yeah, whatever. Just
Thank you.
because obviously we are all concerned about homelessness, especially when it was 7 degrees below zero in North Conway this morning. And I think that we just need to get our
Yeah, I agree.
hands
Yep,
around it.
I totally agree. Thank you.
Okay, so you will send that to the LBA? All right, thank you. All right, now, Representative Leachman, did you have a motion?
Sure, Madam Chair, move the item.
All right, do I have a second? Second by Senator D'Alessandro. Will the clerk call the roll?
Roll call 013. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsell. Senator Gaida.
Yes.
Senator Rosenwald. Senator D'Alessandro. Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The vote is 10-0. FIS 22013 is approved. Now move to tab 6, and it's FIS 22014. Representative Erf, you had some questions on this?
Yes, I got to find them. Thank you, Madam Chair.
Yep, no problem.
You all set?
Yep.
Given the focus
Oh,
on
wait,
it,
we need to, please, we need to, I'm not all set. Thank you. Would you please introduce yourselves for the record?
Good morning, Lori Shibonette, Commissioner of Health and Human Services.
Good morning, Henry Lippman, Medicaid Director.
Okay, now we can try that, Representative Burke.
thank you, Madam Chair. Given the focus on a community-based care model with the expectation of lowered expense, will the review be looking at how to coordinate the organizations working in this space and how to fill the need for employees to work within this model?
So the intent of this money is to take on an evaluation of our current Medicaid model. We've had this model since 2013. And we've never really done a review on, is it fulfilling the need that we originally intended it to? Is it saving us money? Is it serving our beneficiaries correctly? And Medicaid models have evolved over the last 10 years. There are many different models out now. The intent of this money is to look at our model and answer those questions and determine whether this is the right model for the citizens of New Hampshire. Is the current Medicaid model the right model for the citizens of New Hampshire? Now, there are several models that are community-based care. There are ACOs, CCOs, health homes, all of those different models. Yeah, I think that the plan is if the determination is made that there are other models that would fit better for New Hampshire, that we would look at those community-based models. But the first step is to do an assessment of our current model, and this is the first step.
Thank you.
Are there further questions? Senator Gaida?
Thank you, Madam Chair. Thank you, Commissioner and Director. So, a third-party vendor, will this be a sole source contract, or will it be put out to a competitive bid?
It will be put out to competitive bid.
Thank you.
Are there further questions? Seeing none, could I have a motion to accept? Senator D'Alessandro moves to accept,
Second.
seconded by Senator Gaida.
Okay, roll call on 014. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsell. Senator Gaida.
Yes.
Senator Rosenwald. Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The motion is approved on a vote of 10-0, 22-014. Okay. FIS 22015. This is spending some ARPA money. Would you mind introducing yourselves, please?
Sure. Lori Shibinette, Commissioner of Health and Human Services.
And I'm Katya Fox, Director of the Division for Behavioral Health.
Okay. Are there questions?
Lots of questions, probably.
Okay. We'll start with Representative Edwards.
Thank you, Madam Chair. Thank you, Commissioner, Ms. Fox. Good seeing you again. I think my first question really is about precedent. And we had asked Mr. Arlinghouse, is he in the room? I don't think he's in the room. Oh, there he is. We had asked him if there's any precedent for the state to provide money to a private enterprise for purposes similar to this. I would like to know if we're setting precedent or if we have precedent that we're following.
Not to this scale. Last year, I think we set aside about $1.5 million for recovery housing, updates, renovations, things like that within our state, and gave out grants to those organizations to update their physical plants.
We also, with our nursing homes, in order to alleviate the situation, I can't even hear myself, so. To alleviate the situation that we had with our emergency departments and with our hospital systems, we did provide financing of $45,000 a bed to nursing facilities, and that was agnostic to whether they were private or nonprofit agencies.
May I want to ask over your shoulders if Mr. Arlinghouse has anything further on the question.
No, I looked, we asked around in the department, and in particular Joe, and then also Mike Connor, who most of you know has been with us for 47 or 8 years, and nobody remembered anything. There's some vague thought that there might have been a dental clinic a very long time ago in Conway or somewhere up north that something was
Tamworth.
Tamworth. But we couldn't find any record of it, but, you know, we don't know of anything, but that doesn't mean there's not a first time for everything.
Mr. Arlinghouse, Commissioner, could I ask a quick question? The, what is it, Housing Finance Board that works with low-income housing, don't they provide money to commercial people that are constructing these homes for the benefit of low income?
It's a good question. I don't know about that, but it's not an item that the state has been participant in before.
Okay.
Obviously, the BFA does things like this, where they
We
will
give the
will
money
guarantee
to the
loans, but-
BFA and they carry it out. So,
Yeah.
I mean, so it may not be direct, you know, managed by the state, but there are other entities within the state that use our money to do things. So.
Actually, we were just reminded that the state did invest, I believe the legislature directed us to provide Franklin Regional Hospital funding for their designated receiving facility. So it actually was in the terms of a loan at that point in time. But it was a legislative action that directed the department to do that.
Okay, thank you.
More questions?
I'll give you three, and then we'll
Okay, good.
we'll let some
This
other
may be
folks
my
talk.
only other one, but I know that we've received communications back channel from DHHS talking about how the state benefits from this. And as I read the public-facing document, it shows how HCA benefits, but it isn't really clear in the write-up how the state benefits. And I know that we do, but I just would like it in the public record.
So I think, you know, the benefit is quite obvious. We've had an ER boarding crisis for 10 years. We have invested significantly in the community and in the crisis end of things. We have, you know, in addition to investing in the community, which we have substantially for the last 4 years, and in the crisis component, rapid response, mobile crisis teams, the third prong to that system is inpatient beds. Our system has been running at 100% capacity 100% of the time for 10 years. Hospital systems, health systems are not meant to do that. So this project for with that capital defrayment brings on an additional new beds, 38 new beds. So the hospital itself that HCA is building is a 96-bed hospital. The total, they will be closing their behavioral health units in the other hospitals that they own in New Hampshire and moving those beds into this one facility. So the total new beds are 38 beds, 20 in adult, 6 in geriatric, and 12 in adolescent. So that is expected to have a direct impact on our wait list. When you look at our wait list, you may see 10 or 20 adults waiting on our wait list on any given day. What you don't see is that the actual number of ER boarders for psychiatric care is at least 2 times that. The wait list you see is the involuntary wait list. You don't see the voluntary wait list where people are waiting for voluntary beds. So the great thing about the healthcare facility that HCA has agreed to build is that adult beds will be duly certified. They will be both for involuntary and voluntary. They are also agreeing to run some subspecialty programs such as eating disorder clinics, partial hospitalizations, a 12-bed youth facility for youth age 12 to 16. So the state benefits by using ARPA money for infrastructure build. It's one-time payment for an infrastructure build and investing in the infrastructure of our mental health system, which is what, you know, and I understand that this is coming fast. For 10 years, we've had an ER crisis, and we're basically fixing it in 2. And you know, the projects are coming very quickly. But I think the time is of the essence, and we have the opportunity to use our funds for this type of infrastructure investment.
Follow-up? follow-up?
Okay, and so my I think that was an excellent answer. I just wanted it on the record so that the public knows why we're spending this money. The other question I think we need to tell the public is why HCA? Why isn't there another provider out there that we should be putting this $15 million into their infrastructure?
So at the same time that we offered the $45,000 per nursing home beds, we also offered $200,000 per bed for a hospital to convert their beds to a DRF. And although there was interest, no one has been able to execute that any beds for increasing DRF beds across the state. There will be a second request coming forward. This is request 1 to build a 96-bed hospital. There will be a second request coming for a $15 million defrayment to build a second hospital in New Hampshire, pretty much the same size, by another vendor. Those two vendors, one local nonprofit in New Hampshire, and HCA, who has very strong community ties in the Seacoast region, was the second. They are two entities that are ready, willing, and able to build these. We have not had any other health system even approach us about converting beds to involuntary beds, besides the two entities that are offering to build hospitals.
Thank you. Representative Leachman, did you have a question?
Thanks, Madam Chair. I have a couple, but I'll go through the chair, of course. Thank you, Commissioner, and for coming to see us.
Peter, you've got to move
Oh.
your mic closer. Thank you.
Do it that way. Thanks. So it's certainly, there's none of us that would disagree there's a need here. I mean, we've heard that, and we know that. By saying this is moving awful fast, I guess could be an understatement, because I recently saw an in-depth article that was written just last week, and HCA refused to comment to the reporter on what was going on, and said that he would not provide any information at this time, and declined to say when they would. It seems like something like this, you'd want to get the information out there that this is moving forward. The community of Epping is in favor of it. But I reached out to one of our colleagues from Epping, who actually serves on the planning board, and nobody has come to Epping to discuss this with the planning board. And yet, it says, according to a lot of the documentation that we've received, that this facility will be up and running next year. So I wonder if you could comment on that. Why is some of the secretive stuff, or why Epping is being mentioned as where it's going, and yet apparently the folks in Epping haven't heard from HCA?
So we have the CEO of Portsmouth General Hospital here, if you would like him to come up and give you information around HCA and their process. Would that be appropriate?
It's up to the chair.
Yep, that would be fine.
Dean Carucci is here from Portsmouth.
Good morning.
Good morning.
For the record, Dean Carucci, Chief Executive Officer at Portsmouth Regional Hospital. So in terms of the news article, we just didn't feel it would be right to comment at this time, having not gone through this process, and didn't want to get ahead of this committee. So that was the only reason for that. Hopefully within your materials, you can see all the details that we've laid out for the plan. In terms of Epping, it is one location we're considering. We have a few that are right along 101 that is centrally located between what we view as the population centers in the state of New Hampshire, meaning Manchester, I-93 corridor, and then I-95 for the Seacoast region. So we have not gone to planning board yet because we did not want to waste folks' time until we had locked down which piece made the most sense.
Well, just one further question, Madam Chair.
Please, go ahead.
Thanks. So in some of the information that we just received, considerations would have to be given for like property tax breaks. So you would be looking for the community that you would be locating in to give like property tax relief? Is that how I understand your documents?
Those are probably original documents that you have. We do not plan to pursue property tax breaks on this project.
If If I could, Madam Chair, I'm just confused because we just got these documents last week.
Yeah,
So there's been a change since last week.
that's correct.
Thank you, Madam Chair.
Are there any further questions? Yes, Senator Rosenwald.
Thank you, Madam Chair. I have a few questions, if I could. They're focused on the fiscal impact of this project. When we met earlier this morning, Commissioner, when you presented to the Senate members, we were told by the Medicaid director that when this hospital is fully operational, the non-federal cost increase to Medicaid would be about $9.5 million a year. So in total, about almost $20 million a year. What percentage of the patient bed days are we expecting will be filled by Medicaid enrollees?
I'm going to have Henry come up, so he did the calculations.
Thank you.
Thanks, Jean.
For the record again, Henry Lippman, Medicaid Director. Thank you for the question, Senator. In the startup year, it was 1,195 admissions for Medicaid, which is a little over 40%, I believe.
40?
And the adult is 236 admissions. I think in terms of the percentage, it's in that same neighborhood. The startup operations, as I understand the statistics from Portsmouth pro forma, that they're expecting the first year to be a startup, and then ultimately, they expect an average daily census of somewhat less than the full bed complement of 96 as they're beginning the startup. But ultimately, startup is about 73% of full ADC, and so there's another 27% growth, I think, in the admissions that ultimately might be seen when they're at full operational status.
Thank you. Could I follow up? So, Commissioner, you also told us that the department expects there will be savings to the counties in corrections and the New Hampshire Department of Corrections. Do you know, or can you tell us if those entities have been able to calculate savings that they project?
So when I talk about savings in both county jails and the DOC and in a variety of other areas, that is more of the long-term goal. As we build out our system, what we've talked about is that the acute care side of psychiatric care, which is why we filed the IMD waiver, was to attract private entities to come and provide acute care in New Hampshire. So this is one example, and there will be a second example. That will leave New Hampshire Hospital to provide care to those very chronically ill, those people that have 100 admissions to psychiatric hospitals in their lifetime, and they're in and out our doors all the time. We're expecting to still serve that population at New Hampshire Hospital. The forensic population, the justice involved, including the dozens and dozens of mentally ill people that we have residing incarcerated in our county jails. Many of them belong in a clinical environment, not in a clinical environment like Portsmouth Hospital, but in a clinical environment like New Hampshire Hospital. So there are several more steps to the build out of the system before we get there, Senator. So I have not been able to quantify what that overall savings would be to the county system or the DOC system or any of the other systems, including homelessness, all of those other systems that it could impact.
Thank you. One more.
Yes, please,
Thank
go
you.
ahead.
So if 40% of the patients will be projected to be on Medicaid, then up to 60% would be either covered by Medicare or private insurance.
If I could, Senator, I just want to clarify one of the numbers that I gave was as I mentioned to you this morning, were the additional beds, the 38 additional beds that the dollar figure you quoted, and the percentage was based on the additional beds being put into service, the 38 beds.
Okay, but so that's the incremental cost. My question is, because we're talking about really the most expensive hospital system in the state, has anyone in state government looked at the potential impact on health insurance premiums for the voluntary commercially paid beds? I know you haven't, but do you know if, can we be assured that somewhere within the executive branch, somebody is looking at the potential impact on health insurance?
I can reach out to the insurance department and have them do an analysis. But what I do want to stress is that although we're adding beds in New Hampshire, many of our citizens that require this inpatient capacity are just leaving the state to get it right now because it's not available in New Hampshire. But I will have our insurance department look and see if there will be a significant impact by adding these beds.
Thank you.
Yes.
Are there any further questions? Oh, you've had your three, Senator.
No, hospitals took us up on the $200,000 incentive payment. Forget exactly how much that total, but is it coming back somehow, or is it staying out there?
It's not spent. The $200,000 incentives payment. There were several hospitals that were interested, for sure. There was definitely many letters of interest, but COVID hit them so hard in the last year. It is really, really difficult for them to look beyond operating their hospitals day to day rather than taking another risk. So that money will go back in the pot if it's not spent.
Thank you.
Okay, are there any further questions? Seeing none, can I have a motion to accept FIS 22015?
So moved.
Senator Birdsall moves, seconded by Senator Gaida. Will the clerk call the roll?
Roll call on 015. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
No.
Senator Daniels.
Yes.
Senator Birdsall. Senator Gaida.
Yes.
Senator Rosenwald. Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 9-1.
The vote being 9-1, FIS 22015 is approved. We now move to FIS 22035. Welcome back. Would you mind introducing yourselves? If you would excuse me, the reason I am asking to make sure that people talk into the microphone is because this is going out to anyone that happens to be looking at our YouTube, and we do have a lot of folks that do that. So if you could, it's helpful. Thank you.
Mary Calise, Deputy CFO, DHHS.
Katya Fox, Director of Division for Behavioral Health.
Thank you. Okay. Representative Erf, you had a couple of questions.
Thank you, Madam Chair. And again, thank you for your responses to my questions. The only follow-up I have is, will the developed quality performance and evaluation metrics be made publicly available, and in what time frame?
Absolutely, we will do that. We often, and thank you for raising this, because we often get asked at these types of settings, how are you going to measure the effectiveness? And this was an opportunity through this grant to be able to measure the effectiveness of our programs. So yes, we can make those publicly available. I'll have to check with my team at what point in time that we'll have that information available. I will take this opportunity to say that our New Hampshire Rapid Response Program just started. on January 1st, and it's served thousands of people already through our 10 community mental health centers. And we're watching the data almost every day. But for the cost, for really looking at the effectiveness of it, we need a longer period of time for it to be, in implementation and full implementation. So it may take close to a year before we're able to really take that step back and really see how effective it is. The other opportunity that we have with this funding is to look at the model. We have a model. And what we know in New Hampshire is, and our communities and our regions, is that not every model fits across the board. So that's why we want to look at these and look at the rural areas, look at what it means for particular populations.
Thank you, Madam Chair.
Are there any further, excuse me, are there any further questions? Representative Edwards?
This is in the spirit of brainstorming. Earlier, we saw that $290,000 going to the military daycare for alcohol avoidance. I'm just curious if you could consider maybe implementing some training at that child care center so that the kids start to hear it before it becomes a problem for them. I mean, it'd be nice if we can integrate some of these programs.
Absolutely. It's under this effort that wasn't contemplated, but under the Bureau of Drug and Alcohol Services in coordination with the Governor's Commission, and it was referenced earlier by Chair Tufts that we have prevention efforts. And so the Governor's Commission has really taken a strong look and heavy emphasis and put forth proposals that look at prevention efforts. And I can follow up on those efforts and what's happening. But child care serving agencies are really important.
Thank you. Are there any further questions? Could I have a motion? Senator D'Alessandro moves the item, seconded by Representative Edwards. Clerk, call the roll, please.
Roll for 035. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsell.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald. Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
FIS 22035 is approved on a vote of 10-0. We now turn our attention to FIS 22036. Good morning.
Good morning, David Wieters, Information Services Director for DHHS.
Thank you very much. Representative Edwards, I believe you had a question or a comment?
Yes, ma'am. It's kind of a quick one. I think we did this offline, but I want to get it into the record. Mr. Wieters, good seeing you again.
Good to see you.
On page 2, in the first paragraph, second sentence, it reads, the contractor will focus on gathering information on the data being collected, processed, stored, and used within the solution, providing details on the intended use of this data, and assessing the privacy controls. I think all of that's good. I just think it's missing the plans for data retention and the data destruction plan. So, you know, data has a life cycle, and this sentence overlooked the death of the data.
Certainly. Thank you for the question. The intent of that was an overview. Certainly in the contract, it's going to have data destruction, retention, and pretty much everything that you would expect in a data governance plan, to include how people get access, who has access, how it would be shared, with whom, and for why.
Thank you for that. I think it's absolutely brilliant that you guys are doing a PIA on this.
Thank you, Representative Edwards.
Are there any further questions?
Does that mean mean, that Representative Edwards moved the item?
No, not yet. No, because Senator Daniels has a question.
It's just one quick question. Is this going to be a competitive bid or sole source?
Thank you for the question. This is going to be a sole source. The goal is to try to get this done as quickly as possible to address any privacy control issues that may or may not be on the system. We don't anticipate any privacy control issues in the system, but we wanted to have that report to the Health and Human Services Oversight Committee as soon as possible. An RFP would delay that process.
Representative Keith? Representative Irv?
Thank you, Madam Chair. And thank you for the answers to the questions I posed. I just want to confirm that the expectation of privacy assessment will be complete by May of this year and will be made public?
Thank you for the question. So the goal is to have this, if this is approved here at Fiscal Committee, the next step would be going to Governor Executive Council for approval. Once that contract is approved, it will take 6 to 7 weeks to complete. And then once we have that report, we'll need to put it into a publicly accessible like formatting in case the vendor puts it in their letterhead or whatnot. So we're anticipating an extra week for that. So the goal would be 8 weeks after contract execution. Currently set for, if we get the contract approved in February, it would be March, April, in the middle of April, beginning of May.
Thank you. I was actually adding it up, giving you a little bonus time there, too.
I
Thanks.
appreciate that.
Are there any further questions? Representative Edwards?
I'd like to move this item.
Okay, thank
Second.
you. Senator Gaida seconds. Will the clerk call the roll?
Roll call on 036. Representative Edwards.
Yes.
Clerk votes yes. Representative Irf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsell. Yes. Senator Gaida.
Yes.
Senator Rosenwald. Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 10 to 0.
The vote on FIS 22036 is 10 to 0. The item is approved. FIS 22039. I don't think you have that one here.
Yeah, I do.
Oh, you do? Okay. I'm sorry. I did not write down which senator. Okay. Senator Rosenwald, you had some questions?
I just was hoping to get a count of how many households have been assisted by this rental assistance program so far.
First of all, you turned yourself off. Yeah, okay. Thank
Usually red means off. Sorry.
Means it's hot.
It's hot. It's
Hot
like-
mic.
Okay, got it. Okay, with regard to the emergency
you-
rental
yeah.
assistance program,
Could you-
I'm sorry, Taylor Caswell, Executive Director of Gopher in this role. Is that what your question? I'm sorry, Senator.
How many households have been assisted so far?
To date, I believe we've just crossed over 12,000 households that have been assisted. And just for the record also, Senator, that information is on our website. We keep it pretty updated there on the emergency rental assistance program. You can search for how much is for each individual component, rental assistance, utility assistance. You can see all of that information right there. Yep.
Are there any further questions? Okay, Senator Rosenwald moves to approve, seconded by Senator Birdsall. Will the clerk please call the roll?
Roll call on 039. Representative Edwards.
Yes.
Clerk votes yes. Representative Irf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsell. Yes. Senator Gaida.
Yes.
Senator Rosenwald. Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 10 to 0.
FIS 22039 is approved on a vote of 10 to 0. Okay, the next item is FIS 22 42.
No. Next one I have is 016.
Okay. All right,
I heard.
okay.
Mine must have been the stray note. I thought we had agreed to pull it off consent. As I look at it, I don't really have any questions about it.
Okay. Mr. Kane, did we take 042 off? We did. Okay. So I need a motion to approve 042. Thank you, Senator D'Alessandro.
I got to get there, wait a minute.
Okay, no problem. It's in tab 6.
Tab 6, okay. 042, okay, I'm with you.
Okay. It was Senator D'Alessandro and Senator Birdsall.
Okay, roll call on 042. Representative Edwards.
Yes?
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsall. Yes. Senator Gaida.
Yes. Yes.
Senator Rosenwald. Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 10 to 0.
FIS 22042 is approved on a vote of 10 to 0. Okay. We now turn to tab 8.
In tab 7, I thought we had 016 in tab 7.
No, that was taken off.
Okay, sorry.
Okay, tab 8. Mr. Attorney General. The first item on the, on tab 8 is FIS 22011, and it's a request for $2 million. No, it's not. 001. Excuse me, dyslexia, I guess. Okay, and this is a request for $2,853,691 in general litigation expenses. So,
Yeah, would you like me to give an overview?
I certainly think that's appropriate.
Sure.
I don't think anyone here is just going to say, okay, here's
Right.
$2 million.
Absolutely. Thank you, Madam Chair. Thank you, members of the committee. Attorney General John Formella, for the record. As you'll recall, we came before you in August of last year for, I think, approximately $2.7 million for our litigation fund. That was the best estimate we had at the time. As the item explains, we've had a number of developments that have significantly increased our estimated expenses through the end of this fiscal year. One of the primary matters that accounts for this is the Ydc Criminal Investigation and also the civil side of that matter. One thing that I think hasn't been completely understood by the public is that as part of the criminal investigation of the Youth Development Center, we also have to assist the Department of Health and Human Services with responding to requests related to that criminal investigation, and that happens on the civil side of our office. So that has just resulted in a very large volume of records and documents that need to be produced and reviewed. We came before you and got approval for 4 temporary attorneys through ARPA funds. We've filled 2 of those positions. We have another person starting in March, and I do believe that as those new attorneys get up to speed and are brought on, we will be able to reduce the need for outside help in reviewing and producing those documents for the criminal investigation, and also reducing the need for outside help for the criminal lawyers who have to ultimately produce these documents to the defense. So the sheer volume of the documents involved is much greater than I think we anticipated back over the summer. So much of this investigation has really heated up, or I should say much of the prosecution part of this matter has really heated up since we charged 11 individuals back in April. As we've moved, I think we have a better handle now on what we're looking at over the next couple of years, and we'll be able to estimate this more accurately going forward, now that we've got charged cases and now that those cases are moving forward. But anyway, the YDC matter is a big component of this. Another big component of this is a major transaction. I think you're all probably aware of what it is, but a major transaction within our Antitrust Bureau, and it's an investigation we're doing of the proposed combination between Dartmouth-Hitchcock Health and Granite One. So I don't want to go, I can't go into the details of that, but that is a review and investigation that is taking longer than we anticipated it may take back in August. I was hoping that we would have it completed by the end of the year when we came before you in August. At this point, we're looking more towards March or April, and that will result in additional costs. And then the third major component of this request is a couple of federal court cases that we provided you some detail on that got past the motion to dismiss stage. So in August, we were still hopeful that we would not have to go past the motion to dismiss stage in these cases. Motions to dismiss in both of those cases were denied, and what that means is we're now moving into discovery, which will require a large amount of document review, some assistance from outside counsel in how we manage that. It'll require many depositions, so it's just an additional burden on our civil litigation unit. In addition to those three major components, what we're seeing right now, from my perspective, and I've also confirmed this with folks who have been in the office longer, we are dealing with a higher volume of civil litigation than we have in a long time and perhaps ever. We're just in an era where states and governments are being sued more and more often, and so that's placing a large burden on our civil litigation unit. I'm actively working on, and I've tasked the team with working on strategies for how to address this in the next budget. One of the things we've already started to do is obtain things like more up-to-date e-discovery tools to make our processes as efficient as possible so that we do not need to utilize outside counsel for help. But the reality is that if our lawyers are busy with a very high volume of cases, when we get these major matters in order to be able to manage discovery and keep these cases moving along and not get ourselves into a place where we have to settle the cases on poor terms for the state, we need to utilize outside counsel, and that's a significant expense. So again, we'll be putting a lot of effort into how we address that and looking for strategies to address that in the next budget. But for purposes of sitting here now, that really is the major driving force behind these increased estimated costs for the rest of the fiscal year to both prosecute criminal matters and defend the state in civil litigation. So that's an overview of the request. I'm happy to answer any specific questions you have.
Are there any questions? Senator Guida.
Thank you, Madam Chair. General, as you know, this committee has been served. And would it be safe to say that incorporated in the cost you're asking us to fund is potentially your reaction to that action?
Yes, that is one of the many cases we're working on, but yes, we represent all of you and everyone else who's been served in that case, so yes, that would be accurate.
The only one here is Senator Birdsall has not been served.
Yeah.
Change that.
Oh. Excuse me. We shouldn't have fun. Senator Rosenwald.
Thank you, Madam Chair. Good afternoon.
Good afternoon.
I know the state is prepared to go to trial against Johnson & Johnson in a week or two. Is that factored in here, or is that a separate contingency-based piece?
Yeah, that is not factored in here because we signed a contingency fee agreement with outside counsel long ago, and so they're handling all those costs, and whatever we recover in an eventual settlement or a verdict, they will be paid with a percentage of that.
Are there any further questions? Okay, let's divide $2 million by 6 months. That's quite a bit each day. Okay, could I have a motion?
Move the
to-
item.
Thank you, Senator Gaida. Seconded by Senator Birdsall. Okay, would the clerk please call the roll?
Roll call on 001. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsall. Senator Gaida.
Yes.
Senator Rosenwald. Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 10 to 0.
The vote is 10-0 on FIS 22001 is approved.
Thank you.
Okay, turning now to FIS 22032, Department of Health authorization to transfer general funds in the amount of $19,053,889 between various class lines. Decreased federal revenues in the amount of $83,747 and decrease other revenues by $19,057 and create a new expenditure class code.
Mary Calise, Deputy CFO, DHHS.
Could you just give us a quick overview of why we need to do this?
So periodically, approximately 3 times a year, the department does come in and reallocate funding that was originally budgeted to address needs as they have arisen since the budget was passed.
Okay. Are there any questions? Representative Erf.
Thank you, Madam Chair, and thank you for answering questions I had previously asked. I received a spreadsheet in the last day or so, which I'm guessing is from you, which was really helpful in understanding the underlying fiscal note. And I know I'm unusual in this regard, but I would ask, would you might be able to provide that in the future with the fiscal note when it comes out, so I have a little more time to understand it?
Certainly, we've used the same format for well over 10 years and have not been asked to change it until recently, and certainly we can make adjustments to that if it better suits what you're looking for.
Well, thank you for the changes. Those are great, too. But even just even the change without the spreadsheet, I couldn't understand.
Okay.
But once you gave me the spreadsheet, it made a lot more sense. So thank you very much for all the help.
One of the things that the committee has asked and will ask not only Health and Human Services, but all of the departments when it's time to do transfers, that we would like to see what we call a to and from. Okay, so that we know that it's going here and it came from here. Because it's, I'm sure the information is all there, but it's difficult because not all of us are well aware of what's in your budget, although overall we know. So if we could do that, and I know that Mr. Kane has indicated that he will pass that on to DAS. So are there any further questions? Yes, Senator Edwards, or Representative.
Thank you, Madam Chair. You know, one of the reasons I've really enjoyed working with Ms. Rounds this past year is that she's just a straight shooter. And so the question I have here is, while I understand that there's normal budget variances, that our budgeting knowledge isn't perfect and reality is just going to happen, you know. But what I'm curious about is did we learn anything in this particular round of budget variances? Did we miss something? Did we make a significant communication error that we're fixing? I'm looking for, lessons learned.
I would want to do a deeper analysis to be able to respond to specifics of that. One thing that comes to mind, when we budget vacant positions, they're all budgeted at step one. One thing we found is often vacant positions get filled at a much higher step, which means the dollars to pay for those positions weren't budgeted at the appropriate level. So that's something that we could provide data on that might assist in terms of how we could better budget moving forward.
All right, I'm not looking for any more data, but if Ms. Rounds wanted to, inform me if she learned anything in this variance adjustment process that's significant or material, I'd appreciate just hearing that.
I'll speak with her about it.
Very informal.
Thank you. Are there any further questions? Senator D'Alessandro moves approval of FIS 22032. Do I, seconded by Senator Birdsall.
Roll call on 032. Representative Edwards.
Yes.
Clerk votes yes. Representative Earp.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsall. Senator Gaida.
Yes.
Senator Rosenwald. Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10 to 0.
FIS 22032 is approved on a vote of 10 to 0. We now turn to tab 10, FIS 22037 from the Judicial Branch, and this is authorization to convert an existing vacant full-time marital master position to a full-time judicial vacancy in the circuit court. Hi.
Good afternoon, Madam Chair. For the record, it's Gordon McDonald, Chief Justice. With me is Susan Ashley, who's the Deputy Administrative Judge for the Circuit Court.
Thank you. Could you just give us a short overview of, I don't think we have any problem with what's occurring, but it would just be nice for a short discussion. Thank you.
Thank you for the opportunity, Madam Chair. The Circuit Court was created in 2011. When it was created, there were 30, get the number right, 32 judges and 13 marital masters. When the court was created, the legislature provided that when a marital master left, that position could be converted to a judicial officer. And as the materials I submitted with our letter indicate, that has happened 8 times over the intervening period. To have that happen requires 2 things. 1, approval of the Fiscal Committee, and 2, the fact that sufficient funds have been appropriated to cover the judicial officer. And in my letter, I have indicated that we have appropriated sufficient funds for this biennium to cover the judicial officer. We have, at present, 2 marital masters and 39 circuit judges, total of 41 judicial officers. A marital master has indicated that he is retiring as of February 1st, so that would convert that position to a full-time circuit judge.
And how long do we anticipate until someone might be nominated?
That's a great question. I defer to, defer to the governor.
Can't you see the second?
It's, from my perspective, Madam Chair, as quickly as possible, but I leave that to the governor.
Oh, okay. All right. Well, you know, when you lose a person on the circuit court, it really creates a lot of problems, and that's one of the reasons I was asking.
I agree with the chair, and it's one of the reasons we are coming forward as quickly as we are to get the position converted, so there's no undue diminishment in productivity.
Thank you. Are there any further questions?
Move the item.
Okay, Senator, oh, you had a question?
Yes.
Oh, go ahead, I'm sorry.
Thank you. I've been around long enough where I remember the times when judiciary came to the legislature and talked about how they needed all these marital masters. Now we seem to be going the other way. Is the intent to phase out the marital master and convert them all back? And if that is the case, then what went wrong with the previous experiment?
This is an entirely, this is a policy decision that was made by the legislature in 2011. When a marital master left, that position pursuant to legislation could be converted to a judicial officer. So that was the decision, Senator, that this body made back in 2011.
Follow up? As you just stated, it could be converted, but it appears that you choose not to convert it.
I am here asking for the current anticipated vacancy to be converted.
Okay. Let me see if I can rephrase my question. Sure. It's not a requirement that you change a marital master position to a justice position. Is that correct?
No, it does not. If I'm understanding, Senator, your question, it doesn't happen automatically and it's not required. It is within our discretion to come forward to this committee and ask for approval, and ultimately it's a decision for the Fiscal Committee.
So why are we asking for this conversion as opposed to filling it some other way?
There is no other way to fill it.
Okay.
Representative Lynn, you had a question?
Yeah, if I might just add a little bit of context to this. I think Senator, and because I do have some background in this, I think that this is really sort of a long and candidly, I think it's a story in large part of the legislature changing its mind. In 2011, the idea, the statute was enacted that permitted the change, the conversion to from marital masters to circuit court judges. And initially, and I think for that biennium, the idea was that this change would occur by attrition, that as marital masters retired, they would be replaced by circuit court judges. Subsequent to that, and candidly, in my view, very unfairly, the legislature changed its mind and decided that some marital masters should be terminated. And in fact, some were, quite unfairly in my mind. After that, at some point, and I can't give you an example when, but certainly while I was still working in the Judicial Branch, the legislature decided, I think for monetary reasons, and please understand, I'm not criticizing, that may have been entirely appropriate. The legislature decided, well, because marital masters are paid less, maybe it does make some sense to kind of continue with marital masters. And so for a certain period of time, then there were no changes. And now, it seems that has changed again. My understanding, and I asked particularly Judge Ashley, who's been here for a long time, my understanding is that from the perspective of the Judicial Branch, we believed all along from the beginning when this statute was first enacted that although we certainly didn't think anybody should be fired, we agreed with the idea initially that all this change should be by attrition, but we agreed with the idea that it was better to have circuit court judges rather than marital masters. So it was not, as far as I know, it was never the circuit court that thought we should kind of, not make the conversions. But for a period of time, we didn't do it because we understood that that's what the legislature desired. That's, if my understanding, Ms. Ashley, Judge Ashley, is wrong, please correct me.
No, that is an accurate assessment.
Please turn your mic on.
I'm sorry. My apologies. Can you hear me better now? Thank you.
Yes.
So what the legislation actually requires is that that marital master position shall convert to a judicial position upon its being vacant, provided, just as the chief indicated earlier, that there is the request of the fiscal committee to allow that conversion and then the funding being available. It doesn't really give us the option to continue or appoint another marital master in place of the one who's retiring. So that's what we have to do. We have to come and ask all of you folks for assistance with this process in order to fill the vacancy that we have now for the one of the two remaining marital masters who have not yet retired.
Okay, thank you very much.
You're welcome.
Are there further questions? Seeing none, could I, is that a question? Senator Gaida.
Thank you, Madam Chair. So with the addition of this circuit court judge, what will the total number of circuit court judges be?
Total number of circuit court judges will go from 39 to 40.
Thank you.
Any other questions? Seeing none, could I have a motion, please? Senator Birdsall moved. Oh, let's let Representative Leishman. Well, you know, it's okay.
I just need a name.
Leishman.
Or if it's shorter.
Well, will the clerk please call the roll?
Roll call on 037. Representative Edwards.
Yes to approve this divorce.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsell. Senator Gaida.
Yes.
Senator Rosenwald. Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
Madam Chair, before the Chief Justice leaves, I just had something to say.
Okay.
I know it should-
Let me announce the vote.
Oh, I'm sorry.
And then you can say whatever you want.
Don't say that.
Oh. FIS 22037 is approved 10-0. Now, Representative Leishman, you have a comment.
Thanks, Madam Chair. So I haven't had a public ability to say this, but until now, but I worked with the Attorney General, now the Chief Justice, for years on Division I in finance, and I know there was a lot of talk at the time and question about his nomination, but I'd have to say that there's nobody, with the integrity, honesty, and ethics that I witnessed, and I'm so glad to see him in the position that he's in. So thank you.
Thank you. Thank you very much, Representative.
Yes, very good. All right, thank you very much for coming in, and good luck on finding a judge. Pardon? Yeah. Okay, we now turn to the late item from Health and Human Services, FIS 22043. Mr. Kane, for those listening from home or wherever, is this item on the website?
Yes, it is.
Okay, all right. So if you want to find out what we're talking about, you can go to the website and look up FIS 22043. This is ARPA money in the amount of $12,012,000, which will be used to pay for at-home COVID test kits. Okay, that's what it's for. So could I have someone from HHS come forward?
Good afternoon, Lori Shibanet, DHHS Commissioner.
Good afternoon, Jonathan Ballard, Chief Medical Officer for DHHS.
You have a question? All right, two. Go ahead, Representative Edwards.
Thank you, Madam Chair. I have a technical question and a kind of a strategic question to get your thoughts. The technical question is, as I understand it, this $12 million is coming out of federal funds, and then as we sell these, it sounds like we're selling them, that we will have revenue returned and it will be somehow credited back. And so the technical question is an accounting one. Shouldn't there, as we're seeing 12 million going out, shouldn't we see the 12 million coming back in?
Mary Calise, Deputy CFO. It will come back in. We are still working out the logistics with Bureau of Accounting on how we will reflect that.
So will that require another fiscal committee vote?
That remains to be seen at this time. Unlikely, but that remains to be seen. We have not worked out all the specifics.
Thank you. And then a follow-up on this,
Yes.
kind of the strategic question. I don't know really have the feel that you both have for the sort of the rhythm of where we are in the COVID process. We've had Delta, which is a big one. We've had Omicron, which was contagious. But are we buying these kits right as the demand for the kits are about to drop substantially? I mean, the initial estimate of the need was probably done a few weeks ago when it was, oh my God, the world is caving in. But now that we're a little further in the process, I'm wondering if this is too much, too late.
If I may, Representative, again, my name is Jonathan Ballard, Chief Medical Officer. As you're aware, nationally, there's a demand for rapid test kits. It's essential to keep businesses open, children in school, childcare open, the economy continuing to function in the midst of continuous surge in the COVID-19 pandemic. The current situation is the federal government is buying up large swaths of the rapid antigen test. It's been announced that they may need $500 million now, additional $500 million soon, and there's a website that's been released where individuals can request at this time 4 tests to be mailed to their individuals' homes, much like New Hampshire has already done a couple of rounds recently. But what has part of that national purchase is that they are not purchasing stock that is already out in the market produced. They've entered into contracts with manufacturers of rapid antigen tests for those that have not been promised already. What we're dealing with today is this is really a short-term issue in that we have large numbers of people who need access to those tests now, and we have vendors who do have these tests available now, but they're not into the system where individuals can purchase them. There's limited stock in the pharmacies and other locations, and as you've been aware, there's shortages where people are not able to get them. They're there on some days of the week, but not every day, essentially. And so it can create a barrier for schools to be open, barriers for children to have access to those tests and employers. So what we intend to do with this purchase is to go through a competitive bid process. All of those different vendors that are approaching us and saying that they have tests available now, but they can't get them out to the public, we just want to make sure that that access happens. And so through a competitive bid process, working with the Department of Administrative Services, the team that procures medical equipment, to offer that procurement, immediately get these into sell in the state, recover our cost, essentially, not looking to make any profit off of this, but ensuring access to all individuals. So that's all what it is. It's just ensuring access and meeting an observation that we can meet the need.
Okay, so to follow that up, what I think I heard you say to my question is that this is the right quantity at the right time, that we, knowing what we know today, we are validating the decision that was probably made a month or so ago.
That's accurate, Representative. Aware the department worked with our partners at the CDC and the NIH to be the only state that dispersed an initial round of nearly 1 million tests, and then we were able to do it again with another round of 750,000 tests. That got us through about 2 weeks in early December, another 2 weeks there in late December, and then this would be another essential round of a similar size quantity that could get us through, the next, period.
Senator Rosenwald.
Thank you, Madam Chair. What is the projected date for having these kits in the stores and ready for sale?
So simultaneously, we did not want to slow down, and we also wanted to have New Hampshire have the advantage of obtaining the tests that are out there and the limited number that are already produced and ready. So we've been working with Department of Administrative Services to open the competitive bid process. It actually closed today. We're actually able to open all of the bids and find out what they are. We had a number of, I don't know which one will be chosen. It'll be competitive and go through proper procedures, but a number of these different manufacturers and distributors have the test in hand and have indicated that they would like to ship them directly to the warehouses and get them out into the stores as quickly as possible.
Follow-up?
Thank you. Does this then have to go to the Executive Council also? So I'm really looking for a date when these tests will be in the stores.
So the next Executive Council meeting on the 27th, I believe, will have an accept and expend of these funds, but because it's going through the competitive bid process, it's not a contract, it's through actual procurement through existing vendors. But it's the 27th. It does have to go through Executive Council in a different form to use the funding. And then at that point in time, the vendors would have the go-ahead that they would be paid and would be able to start shipping to the state.
So 7 to 10 days after the Executive Council. He's a doctor, I'm a nurse.
And we're all patients. Senator Daniels, you have a question?
Yes, thank you. The explanation states that the funds from the sales of these will then be reallocated to another eligible expense under the normal process. Does that normal process include coming back to fiscal to determine where the 12 million will be reallocated, or are they going to be able to just take that 12 million and put it wherever they want without coming here?
That speaks to when we get this money from the sales, it will free up the ARPA dollars that are being used to make this purchase, and those dollars would then be reallocated through the normal process.
I understand what I'm saying. I'm asking what the normal process is. I'm asking if then somebody can take that $12 million and go and spend it without coming back to fiscal, or whether they're going to need to come back to fiscal and say, we want to reallocate it.
I believe they would need to come back to fiscal, yes.
Okay, thank you.
Senator D'Alessandro.
Thank you very much, Madam Chairman. Dr. Ballard, thank you for all of the work that you have done. I call and you pick up the phone. Do you know what an exhilarating experience that is to have someone actually answer the damn phone? And you do all the time, and I thank you for that, because that shows we have responsible public servants there when we need them. And that is essential. That's what makes government work. You're helping to make government work. I'm appreciative of that, truly. So I want to thank you. Thanks. I didn't get any comments with regard to my health or anything of that nature. It was just a professional question, so thank you so much. He's not acting as my doctor, but he's acting as a state employee. Thank you, Madam Chair.
You're quite welcome. Representative Leachman.
Thank you, Madam Chair, but when I see D'Alessandro's numbers show up on my phone, I usually don't answer it, so. But I do have a real question. So you don't have an idea right now of the cost associated with these kits and what the administrative costs might be that someone would bear if they purchased one?
Thank you very much for that question. So the open market, I think they're around $10 to $12 per test. So that's actually the fee that the federal government has said that insurance should be reimbursing persons for, would be $12 per test. And so that's sort of the cost. You know, if you have a box that has 2 tests in it, $20 to $24. But I guess I can say that now that the competitive bid process is closed. Didn't want to say that in advance, obviously. And then there would be, I don't know about the actual fee for the Liquor Commission to be able to sell the product, but somewhere on the range of $1 to $2 is what we understand.
Thank you, Madam Chair.
Are there any further questions? Senator Gaida.
Tongue-in-cheek, Madam Chair, I would inquire if the Liquor Commission is expecting to see an increase in revenues because they are the point of dispensation of these tests. Just saying.
Thank you, Senator. We have heard that you can get a COVID test and a glass of wine.
Yeah. Certainly works for me. Okay. Are there any further questions? Seeing none, could I have a motion to move by Senator D'Alessandro, seconded by Senator Birdsall? Will the clerk please call the roll?
Roll call on 043. Representative Edwards.
Yes.
Clerk votes yes. Representative Earp.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Birdsall. Yes. Senator Gaida.
Yes, with Merlot.
Senator Rosenwald. Senator D'Alessandro. Yes. Representative Umberger.
Yes.
Madam Chair, the vote is 10 to 0.
The vote on FIS 22043 is 10 to 0. It is approved. Okay, we now move to the information items. And I do have a couple of comments that I want to pass on. First of all, Melissa Rollins is receiving a step increase. She has recently joined the LBA, and she was with New Hampshire state government before, so this was a standard procedure, just appears to be a little early. The second thing is DAS has provided a health insurance request or information. And I just felt that this was an excellent report and that your folks that are managing the health benefits are obviously doing a good job. And because some of us remember when you were here pleading for money because the health insurance and dental insurance were in such terrible state. So thank you for getting us to the point where we can be very pleased with what's going on in the health insurance arena. So thank you. We also got a report on PFAS and all that other stuff that goes on with that. And I want to thank Environmental Services for that information. And it may be that I just had not been keeping up with all the reporting, but it certainly helped me in understanding what was going on with the PFAS in New Hampshire. FIS 22119, which is the operating statistics dashboard. Let me get to that one. Did anyone have any questions on this besides me? This is just a very simple question. We all obtain eye strain from reading your dashboard. And it makes it difficult to try to come to grips with all of the hard work that you're putting into providing us the dashboard. And we really appreciate it, and we appreciate the information, but it's just, I don't know. I don't have any answer to it, but I just know that you heard Representative Leachman say that earlier today, and I don't know. I don't know how to solve the problem.
Well, 2 years ago, I wanted to change the dashboard because I felt like there was more relevant information that I could provide the committee rather than going back to 18 and 19, and I was asked not to change it.
Who asked you that?
Fiscal.
Does anyone have any objection to to making changes?
I'll continue to provide what I have, and then when we come up with a new dashboard, I'll provide it in addition to, so that you can see whether the new format and the new information better suits or is more relevant to your decision making. When I look at this dashboard and I see years past, I don't know how it's relevant to some of the decisions you're making, and that's what makes the print so small, is that we go back so far. So is there a better way to provide you this information that makes it more relevant and useful to the discussion and to the decisions?
Thank you.
Okay, I'll work on it.
Okay.
It
well,
probably won't be ready for next month, but in the coming months, I
All
will,
right,
I will come with
yeah,
something.
Okay, thank you very much.
Madam
Great.
Chair, could I
Yes.
follow up on that?
You certainly may.
You've mentioned that you would like to provide us information to help us make our decisions. The information I also get extremely interested in is the critical information that's driving your decisions and your management of the department. So if you could think of it as, you know, a two-way thing, because I'd like to have some insight into what is driving your decision making.
Sure. And we talked a little bit about that this morning at a pre-fiscal meeting around coming with more of a strategy, like a meeting where I can lay out the strategy, let's say for around mental health, you know, and all of the projects we have coming forward now, that I could lay out more of a strategy rather than the individual project. And although I often communicate with the chair or with Senator Morris, I think having a wider audience so that you understand my strategy or the department's decision-making is more helpful for you.
Great. Representative,
It
this
also-
was not supposed to be a big discussion.
This is a question.
Go ahead.
Could you also provide the underlying spreadsheets then as well?
The underlying spreadsheets for,
A lot of these, I assume a lot of these elements of the dashboard are spreadsheets, and they should look like spreadsheets.
I think a lot of them come right from our budget software, but yes, we're gonna start from scratch, so I'll see what I can provide, and we can have many iterations of it.
If there's a question, Ms. Rounds can contact me. She'll know what I want.
Okay.
Okay, I do have just one quick question, and that is on your caseload versus unemployment. And I just, I can't understand why, since the COVID, we had the large unemployment in April, and it's continued to go up. I know that there's supposedly a thing that says you can't have anybody leave, but it just seems to me that it's getting to the point that I obviously need to understand this better.
That is, you know, the issue is that during the federal public health emergency, you're not able to take anybody off Medicaid. So because the public health emergency, the federal designation of the public health emergency is going on for an extended period of time, we do believe that the federal government is going to make an effort to decouple those two things so that we can start doing what we are calling Medicaid unwind, which is taking people off Medicaid very quickly. So the increase that you see in Medicaid and caseloads and things like that, that's what it is through 20 and 21. But that's federally mandated.
No, I got that. I guess that what concerns me is that our Medicaid caseload, or the caseload, has remained at about 12% forever. And so, anyhow, that's enough of that. But thank you very much for the information. And we really do look at it. So, okay, audit. Okay, does anyone have any questions on the audit for the Sununu Youth Center? Okay, seeing none, we have 3 audits, basically from the, now don't all of you run away. I mean, I don't know. These audit folks have worked very, very hard, and I know that you're all interested, especially when it comes to you. Okay. So,
good afternoon, Madam Chair, members of the committee. For the record, Steve Smith, Director of Audits. The first audit we'd like to present is the Turnpike Systems Annual Financial Report. KPMG actually conducted this audit, and so with me is Bob Mahoney. He was the partner on the audit, and also Karen Farrell, you'll remember from last Friday.
Last week.
She was the manager on the Turnpike audit. And also joining us is Marie Mellon, the Director of Finance for DOT. So I'll turn it over to Bob.
Great, thanks, Steve. For the record, Bob Mahoney, an audit partner with KPMG. This is my first year serving as the Turnpike System audit partner, and just wanted to indicate the materials that hopefully you have in front of you, one being a copy of the financial statements, secondly, a copy of the Internal Control over Financial Reporting and Compliance Report, also known as the Yellow Book Report, and thirdly, a debt compliance letter. So those 2 last reports should be separate handouts in your materials. So I will cover the results of the audit opinion, as well as the Internal Control over Financial Reporting and Compliance Report, and then I will turn it over to Karen Farrell, who was the senior manager on the audit, to cover the debt compliance report, as well as the required communications to the committee. With respect to the audit opinion on the financial statements, which is starting on page 8 of the financial statement handout, our audit opinion was unmodified this year, also known as a clean opinion. So congratulations to Marie and her team for all the hard work that they do to prepare for the audit and prepare accurate financial statements. In addition, the audit opinion indicates that management is ultimately responsible for the accuracy of the financial statements, and the auditors, us, are responsible for expressing an opinion on the financial statements. In addition, the audit opinion indicates that we conducted the audit in accordance with U.S. generally accepted auditing standards, as well as government auditing standards. And lastly, the opinion references a separate report, which is the Internal Control over Financial Reporting and Compliance Report. And in that report, you'll notice that there were no significant deficiencies or material weaknesses identified during the course of the audit of the Turnpike system. So overall, the audit went well, and I will turn it over to Karen to cover the debt compliance report and the required communications.
Okay, thanks, Bob. So the debt letter is just the one single page with a signature in the bottom.
And really, the Turnpike system has to comply with certain provisions and covenants in their general bond resolutions. And so what we do as part of the audit is review those, and we did not find any compliance issues with them not complying with the general bond resolutions. So again, another favorable letter for the Turnpike system. The second thing I want to do is, again, go through those required communications, very similar to what I did last week. It's just specific to the Turnpike system because we are required to do these under AICPA auditing standards. The significant accounting policies of the Turnpike are described in Note 1 of their annual report. We did not identify any unusual transactions throughout our audit. The management has to come up with or make judgments over certain estimates, such as the allowance of doubtful accounts over the toll violations, and we review these estimates and deem them to be reasonable in light of the financial statements as a whole. We did not have any disagreements with management or any scope limitations in completing our audit work. As far as we are aware, the Turnpike did not seek other auditors' opinions on the application of generally accepted accounting principles. We did not discuss any major issues with management prior to our retention as their auditors. We did receive full cooperation of the staff and management from the Turnpike throughout the entire audit. We need to confirm that we're independent auditors of the Turnpike system under relevant professional and regulatory standards. And we did not identify any suspected or actual fraud involving management or those close to major components of internal control, or where fraud resulted in a material misstatement of the financial statements. And we did not identify any material noncompliance related to laws or regulations. Finally, I have to inform you of an audit difference that we noted, and this is one that's been noted in the past few years, and that's related to the liability for the OPEB trusted plan. And that is because the state has determined to record that liability entirely on their books because of the amount and not allocate the portion down to the Turnpike. So if the Turnpike recorded that, their OPEB liability would be $1.2 million higher. We assessed that in regards to our materiality that we calculate and determined that it was not material that it would affect our audit opinion on the Turnpike financial statements. So any questions? We would be happy to take those now.
No, I thought the audit was great, all the comments. Did you have a question? Turn your mic on.
In the items on financial highlights, you noted that the revenues were decreasing. You didn't in any way mention the cancellation of the tolls, that we had eliminated tolls. I think 2 times and one more time this, I think January, the last toll booth was canceled. When is that going to be considered in the report and that loss of revenue?
Yeah, so, is it on? Yeah. Okay. So the loss of tolls the first time was in fiscal year 20, and then the tolls that were just removed were in January a few weeks ago, so that'll be fiscal year 22. So in fiscal year 21, we didn't have any toll removals that were part of that loss of revenue. It was primarily related to COVID and the reduced traffic on the Turnpike system.
And one other question from, and the fact that we don't collect tolls between 10 o'clock at night and 6 o'clock in the morning, what effect has that had on people running the toll booths?
Well, we do use all electronic tolling, so we do take pictures of the license plate, and then they do have 7 days where they can go into the system and pay it, or we will send a bill out after those 7 days, and we send an invoice to their residents to collect.
Okay, thank you. Thank you, Ann.
Are there any other questions? Okay. Marie, did you have anything you wanted to say?
Unless you have any more questions, but really just to thank the auditors, KPMG, Dana Call and her team, and also the team at Turnpikes and DOT, because without all of them, this wouldn't be clean, and they do a really great job. So I just want to thank all those involved.
Okay, thank you very much. Appreciate that. Marie, I guess you can leave unless you're interested in.
Thank you. Should we write these down because we have masks? No? Okay.
But
Masks will help that. All right, thank you.
Thank you. We'll see you soon.
We'll be back.
Steve, which one are we doing first?
The next one will be the Lottery Commission.
Okay.
And Our office performed this audit. And joining me here is Kim Bisson. She's the manager, conducted the audit from our office. And joining us from the Lottery Commission is Linda Plant. She's the COO, and then Jim Duras, the CFO, for any questions you may have. So Kim?
Am I using this one? This one's on, right? Okay. Good morning, Madam Chair and members of the committee. Again, for the record, my name is Kimberly Bisson. I'm here today to present the results of our audit of the financial statements contained in the Lottery Commission's annual comprehensive financial report for the fiscal year ended June 30th, 2021. The financial statements begin on page 36 of the Lottery's ACFR. Lottery management is responsible for the preparation and fair presentation of these financial statements in accordance with generally accepted accounting principles. Our auditor's opinion and report can be found on pages 19 through 21 of the report. And as described in the opinion paragraph on page 20, we've issued an unmodified or clean opinion on the Lottery's basic financial statements, which also include the notes and other supplementary information. While our opinion speaks directly to the basic financial statements and notes, no matters came to our attention that caused us to believe that other information in the financial section of the report was inconsistent with the basic financial statements. Auditing standards require we make a number of disclosures to you, and these disclosures were previously discussed by KPMG. So in the interest of time, I will not go through each of them individually. However, we can say that we were satisfied with the cooperation of the Lottery and the progress of the audit, and there is nothing that we need to bring to your attention related to any concerns with those required disclosures. Also included inside the back cover page of the report is a multi-page letter that presents the results of certain agreed-upon procedures which we performed over the Lottery's operation of its Lucky for Life game. All states offering the Lucky for Life game are required, as a condition of participation, to have similar agreed-upon procedures performed, with the results reporting to the other participating state lotteries. In accordance with government auditing standards, we will be issuing a report on our consideration of the Lottery's internal control over financial reporting and on compliance in other matters as a byproduct of our audit of the financial statements. And that report will be included in the management letter, which will be presented to this committee at a future meeting. This concludes my presentation. I'd like to thank Lottery Commission management and their staff for their assistance during the audit. And if there are no questions, I'd like to turn the presentation over to Lottery to provide their perspective.
Thank you. Thank you. So, what do we have from the Lottery Commission?
Jim Duras, CFO for the New Hampshire Lottery Commission. We would like to thank it was another 3 months with the LBA is always a wonderful thing. It was a pleasure working with them this year, and it was also a pleasure reporting $45 million additional revenue this year. The numbers like that make it a lot more fun to do all the work, but it was a good audit, and we appreciate their help.
Thank you. No? Okay. Are there any questions from us? Okay, seeing none, thank you, and keep up the good work. $45 million extra for education is welcome. Okay, now we move to liquor. I have got to
Our
get-
last audit, also conducted by our office, is the Liquor Commission on their ACFR. And from our office, Jean Mitchell, she's our financial audit supervisor. She will present our audit. And joining us from the commission is Chairman Malika and Tina Demers, the CFO.
I'm short enough, but these chairs are very low. Excuse me. Good afternoon,
Yeah,
Madam Chair,
I-
members of the committee.
I have got to have someone get that chair raised because I sat down and thought I was on the floor yesterday, so we'll fix that.
Yes. Well, that's good. I like to be young, so that's a great thing. So, members of the committee, for the record, my name is Jean Mitchell. We are here today to report the results of the audit of the financial statements contained in the Liquor Commission's annual comprehensive financial report known as an ACFR for for the fiscal year ended June 30, 2021. Our auditor's report and opinion dated December 17th, 2021 can be found on pages 12 through 14 in the financial section of the report. As noted in the opinion paragraph on page 13, we have issued an unmodified opinion on the financial statements. For fiscal year 2021, the Liquor Commission produced a full aquifer that includes an introductory section, a financial section with management discussion and analysis, financial statements, notes, required supplementary information, as well as a statistical section. An important item to note, no material adjustments to the accounting records were proposed as a result of our audit. As mentioned by KPMG during their presentation of the Turnpike System Annual Report and further explained in the handout letter, as a result of the state's decision not to flow the New Hampshire Retirement System Subtrust OPEB expense and related liability down to the enterprise fund financial statements, we identified a significant but non-material uncorrected misstatement, understating the Liquor Commission's OPEB expense and related liability by approximately $3.8 million. The auditor disclosures you have previously heard also pertain to the Liquor Commission. I will not go through them individually, but will say that there's nothing that I need to bring to your attention. We will be issuing a report on our consideration of the Liquor Commission's internal control over financial reporting, compliance, and other matters based on our audit of the financial statements, which was performed in accordance with government auditing standards. And that report will be presented as part of the management letter at a future committee meeting. I'd like to thank the Liquor Commission management and staff, as well as the State Comptroller's Office for their cooperation and assistance during the audit. And I will now turn the presentation over to the Liquor Commission management.
We'll ask. Go ahead, Mr. Malachi.
Thank you. For the record, Madam Chair, Joseph Malika, Chairman of the New Hampshire Liquor Commission. We just today like to thank Jim LaRiviera, Gene, and Steve. Wonderful job. We're always pleased to have them come look at our organization to make sure it's running as efficiently as it can. And I'd just like to turn it over to Tina for a couple of comments that she'd like to make.
Sure.
Thank you.
Good afternoon. For the record, my name is Tina Demers, CFO for the Liquor Commission. And I would just like to point out two items on the table on page 17. You have under the distribution, the final transfer to the general fund was $164 million, which was $5 million more than the actual cash transfer for the fiscal year. And this is resulting in a due to the general fund of $5 million, which we will be transferring next month. And the other is a clerical error in FY20 column. The $10 million should be in the line above under the transfer to the Alcohol Abuse and Prevention Fund, not to the Granite Advantage Healthcare Trust Fund. And that's all I have. Thank you.
Okay. Representative Edwards, you had a question?
Yes, ma'am, thank you. And I'm horrible with names. I'm the female auditor. You mentioned that you had one, I think you said you had one significant finding but no material findings. But you had mentioned significant and material as two different things. Would you remind me what the distinction is between those two terms?
Sure, if you go to our auditor's opinion.
Just layman stuff is good.
Okay, a material weakness would be that during the normal course of business, there could be a material misstatement in the financial statements that would go undetected. A significant difference, and it's basically based on numbers. So if you have a $100 million balance sheet, for example, materiality may be 5% of assets, whereas significant difference may be a much lower number. So it's just
okay, so it's there's a quantitative portion.
Quantitative as well as a qualitative if there was like a fraud or something like that.
Thank you.
Yeah.
Are there any, Representative Leachman? Speak into the microphone, please.
Thank you, Madam Chair, and I guess a question for Tina, if she would take it. On page 30, there's a section at the bottom, bonds payable maturity. See that? Let me get there. I was just curious, the range of interest shows from 2% to 9.5%. Have you folks been able to negotiate any better rates, or are those pretty much locked in?
Those are locked in and it's done through Treasury.
Right. I didn't know if Treasury had reached out, or you had reached out to Treasury to see if you could modify them. I know Treasury has made some adjustments on other bonds for the state, so I was curious.
Oh, we have not.
Okay. And just, I guess, one final question.
Certainly.
Could you speak to the debt service? I see that's pretty high, 4.9 is, and if you travel down through it, it's remained, you know, of a fairly high, at least in my opinion. Any real reason for that? New building construction, I know you've put up some new facilities. Is that driving that, obviously?
That and our new POS system that we're
Okay,
in
the
the process
POS
of.
system, okay.
Yes, that's a $20 million project.
Okay, thanks so much.
You're welcome.
Thanks, Madam Chair.
You don't have that in your pocket to pay it
I
down?
don't have that in my pocket, not today, Madam Chair.
Okay, thank you. Are there any further questions for the Liquor Commission or the audit LBA? All right, seeing none, I said I'd be here till 1 o'clock, and I missed it by 4 minutes. So thank you all for coming, and thank you for all of your work for the state. Appreciate it.
Thank you, Madam Chair, for another wonderful meeting. What an experience being here. You make our day.
Yeah, thank you.
Really.